Well, hi, everybody. I'm Meg Terrell. I'm Senior Health and Science Reporter for CNBC, and I'm today's moderator for this fantastic panel called From Idea to Impact, the New Market for Public Health Entrepreneurs. Thanks so much to our panelists and to our host, Harvard Public Health Magazine. This is a topic that has fascinated me for a very long time that I've talked about with a few of our panelists before. The idea that public health obviously has been shown to be so incredibly important through this pandemic, but in previous times, science and business and medicine have never really been able to keep up. And there hasn't been this sort of melding together of capitalism with public health that has yielded a lot of successful results before. That does appear to be starting to change. More people from the world of public health are looking to take their discoveries commercial, and investors are listening to that. So today we'll have the chance to talk with founders and investors about the challenges and rewards of public health entrepreneurship. So I want to introduce our panel, and then I'll ask each panelist to say a little bit about their organizations just so the audience can get to know them. We have George Scangos, the CEO of Vir Biotechnology, Jenny Yip, the managing partner at Adjuvant Capital, Mariana Matus, co-founder and CEO of BioBot Analytics, Tim Rowe, founder and CEO of the Cambridge Innovation Center, and Dan Wexler, CEO and founder of EatWell. George, why don't you tell us a little bit about Vir?
Okay, sure, Meg. First, thanks for having me. Delighted to be here. It's an interesting panel. Look, Vir is a biotechnology company headquartered in San Francisco. We were founded 5.5 years ago, with the goal of developing therapies and prophylaxis for global public health issues. We are now a publicly traded company, so we're not a charity. And so we have a mixture of programs that target diseases of the first world, as well as diseases that occur globally. The mantra for a long time was that you couldn't make money in infectious diseases. And I think that's a gross overgeneralization. I think Gilead has shown that you can make a lot of money in infectious diseases if you tackle the right diseases with success. COVID, as Vir, have an antibody sotrovimab that's been used for treatment of COVID. Obviously, Lilly and other companies have actually made substantial profits and money on treatment of COVID. None of us knew if that was going to be the case when we started working on COVID. We started working on it because we thought we could bring forward an antibody that could save lives. And we had a responsibility to do that without knowing if that was going to be a money-making, money-losing proposition. We have now programs aside from COVID in flu, in HIV, an HIV vaccine program that's supported by the Gates Foundation, on TB, on hepatitis B, on hepatitis Delta. So these are diseases that do occur around the world that affect the developing world more than the developed world, although there is a market for them in the developed world. So they're kind of both public health and commercially viable programs. There are other programs where we have, for example, rabies or Ebola. We have an antibody, we generated an antibody that's now approved for the treatment of Ebola. We have potential treatment for rabies. They're harder to justify with our own funds. And for those kinds of programs, we're looking for support from other agencies. We'd like to bring them forward. But again, we're not a charity, and so we will do those if we get the appropriate support.
And Jenny, tell us a little bit about you and Adjuvant.
Great. Hi, everybody. I'm Jenny Yip. I'm one of the managing partners at Adjuvant Capital. We are a life sciences investment fund dedicated to tackling global health challenges. And so what I mean by that is we invest in companies like Vir and like others that tackle, that do R&D for drugs, vaccines, med devices, and diagnostics. Because we are tackling global health challenges, we focus solely on high burden infectious diseases and sexual and reproductive health. We are a firm that's based in San Francisco and New York. And while most of our portfolio companies are based in US and Europe, because that's still where many of the clinical innovations are coming from, we have as a mandate all of our target patients and target beneficiaries have to include those living in lower and middle income countries. So I think all day, every day about improving healthcare access and healthcare equity for low resource communities.
Mariana.
Thank you. Hi, everyone. My name is Mariana Matus. I'm co-founder and CEO of Biobot Analytics. We are a venture-backed startup based in Boston and New York. And our vision is to transform wastewater into a source of public health data. My co-founder, Nusha Gailey, and I came together realizing that public health can be much more data-driven and much more proactive, as COVID-19 has shown. And that fortunately, we actually are all literally sitting and walking on an amazing source of data, the wastewater that is flowing through our cities every day. When we founded the company about 4 years ago, similar to George, the feedback that we got was that infectious disease isn't a top priority for countries like the US. And therefore, we went to market creating solutions towards the opioid epidemic, which was considered the #1 public health priority for the country. And in early 2020, we decided to go into COVID, again, not knowing sort of the massive scale and impact that the pandemic would have in the entire world. And that meant that we have been there now for a couple of years, serving these new type of data to government officials all across the country. We are now partnered with the CDC and governments across most states in the US. And we're now about to think about kind of that post-pandemic roadmap and how to continue to expand this platform, not only within the US, but also internationally. And it's a pleasure to be here with you all today.
Tim.
Thank you, Meg. My name is Tim Rowe. I'm the founder and CEO of Cambridge Innovation Center. We operate the largest network globally of what we call innovation campuses. These are large facilities, typically next to a university, with laboratories and offices for startup companies. We don't only serve companies in the public health area, but we do have lots of public health activity. During COVID, we launched a subsidiary in partnership with Dr. Atul Gawande, focused specifically on providing logistics and infrastructure support around COVID testing and vaccination. We were fortunate to be asked by a number of state governments to play leading roles there, and we I believe, are the largest COVID testing and vaccination company now in New England. Having run, for those of you who are in the Massachusetts area, having run the vaccination centers at Fenway Park and Gillette Stadium and a few of the others. We're excited to have this conversation and share our perspectives on where public health is going forward.
All right, and Dan.
Hey everybody, thanks for having me. I'm Dan Wexler, CEO of Eat Well Meal Kits, where we believe wholesome food changes lives. Eat Well creates food as medicine meal kits that are designed to cater to the needs of Medicare and Medicaid audiences. And at the start of COVID in 2020, we pivoted our focus to food access and emergency response. And from that grew into our B2B model, where we partner with community health centers, hospitals, and insurance companies to prescribe our meal kits to patients who are high risk for food insecurity, diabetes, or really experiencing significant health inequities. Our meal kits can now be prescribed to these patients to help alleviate those barriers and form sustainable, healthy habits to improve their health, not only during the course of a meal kit program, but beyond that in all the other meals they may eat.
Well, this is going to be a fantastic conversation. I want to encourage folks out there in the audience. We've already got a lot of great questions from you, but if you want to drop any additional ones into the YouTube comments section, please do that, and we'll try to get to as many in the course of the conversation as we can. George, I want to come back to you to essentially that mantra that you said, was the traditional thinking as Veer was founded, that infectious diseases are just not an area that investors are particularly interested in. What have your conversations been like compared, before the pandemic to now? Have they changed in a dramatic way? Has the pandemic proven the utility of companies like yours? Are you still fighting for things like the flu program, or as you mentioned, the rabies program, things like that? I think you might be on mute.
Sorry, I think I know better by now, but it varies depending on the program. So for example, we have an antibody that we are developing for prevention of flu. We've extended the half-life. The goal is to be able to administer the antibody in the fall and provide passive protection for people for a period of months. That approach prior to COVID was viewed with huge amounts of skepticism, and it was hard to convince people that that actually was a market that had value. Not so much now. I think COVID has shown us, number one, that antibodies can work for respiratory viruses. They work not only for RSV, but obviously for COVID. And so the chances that an antibody will work for flu, I think, are viewed as higher than they were before. And the need, even in the face of vaccines, for treatments that can keep people out of the hospital is recognized. So those kinds of programs, that program in particular, is viewed, I think, quite differently now from how it was viewed pre-COVID. I don't think it changes the needle at all on things like rabies. And, there are a single-digit number of rabies cases in the US, for example. So that's entirely a problem of the developing world. And so that is not something I think it's even fair to ask investors to fund. That's not their job, right? And but it is fair to look at NGOs and other sources of support so that we could bring that forward.
That makes me want to bring it over to Jenny. I mean, how do you look at that question? Is it fair to ask investors to fund a program like that, or does that just not make sense? Where do you kind of draw that line and figure out where to put money?
Yeah, I totally agree with George. I think there's certain things that have changed in the pandemic and people recognizing that there is a financial return in flu or whatever the program is, but there are also things that have not changed. Investors are fiduciaries, and our responsibility is to generate financial returns for our investors. At Adjuvant, we have that responsibility and also to generate global health impact returns. So we have a double mandate, if you will. But I think just to add to George's comment, the other thing that has changed, though, is even US-based investors who typically wouldn't necessarily look at, or as a first market, look at markets ex-US. People are starting to recognize that, a COVID test that could be sold here could also be sold ex-US for a fairly lucrative price. And so the notion that public health and global health transcends all borders, not just because they're infectious diseases, but also because they're market opportunity, I think that has certainly changed post-COVID.
That makes sense. Mariana, tell us about founding BioBot. I have a note here that you had to tell investors you wanted to be a self-made billionaire to get them to take you seriously as a founder. So you were founding the company. Just tell us about that experience and how you thought about sort of structuring it, and whether you ever thought about doing it as a social benefit corporation.
Yeah, definitely. I think that something that my co-founder and I experienced early on during the founding of the company was that investors saw that, number one, we are a public health company with a very strong mission, a very strong social mission. And number two, we were like a couple of women. And I think like those two things together, like the assumption was like, why don't you guys just start a nonprofit? Because clearly like all that you care about here is the impact, right? Like all of the, your objective is to create social good and have an impact on the world. So maybe a nonprofit could be a better fit. And, it was interesting that we had to actually spell out like, no, I believe that we can do good and make money, and my objective personally isn't just to have an impact on the world. I also want to make money. I want to be one of those stories of becoming like a self-made billionaire. So it was just interesting that there was the compounding, the compounding not just of the market and the mission, but also the fact that we were women co-founders.
Well, Dan, what was the experience like for you? I mean, obviously you also have a socially minded mission. Were you met with a lot of skepticism, and how did you pitch your company to investors?
Thanks for the question. I think the first thing that we did was create some segments of different types of investors. And we really found three categories. The first are investors who are exclusively focused on returns and don't give merit, so to speak, to the social impact that we have. And we really write those investors off. I think that they're not the type of investors that we're looking to have support and back our organization. They're not going to be able to bring in the right supports for our future growth. And quite frankly, if you're not giving merit to the impact that we have, we're not really going to be a compelling organization compared to somebody that's 100% profit focused. The other two categories of investors that we would look at are folks who are, say, 80-20, interested in impact, interested in financial return, and then 80-20, interested in financial return, 20% interested in impact. And really, besides the little dance of saying we are a for-profit company, we are a public benefit corporation, but we're a for-profit company, and that is just an organizational structure, we really pitch them the same way. I mean, I think that the conversations, the details, the questions that we get into differ, but we tell the same story, and we lead with the mission. We're here to have impact. We're here to alleviate food insecurity. We're here to prevent diabetes. That's what we're trying to do. That said, diabetes, for instance, is a $330 billion problem annually every year. There is such enormous spending. And so if we can have impact in preventing diabetes and improving those health outcomes, the financial return, the financial health, ROI, whatever you want to call it, for the partners, for Eat Well, and for our investors will almost necessarily follow.
How hard is it to convince insurers to reimburse for food prescriptions?
I think it depends on the type of insurer. I think similarly, there are groups that say, look, food is not really important here, and we don't really try and spend time convincing folks that food is medicine, that food is an important part of healthcare. We say, okay, thank you for your time. I'm going to go speak to other folks. And I think some insurance companies get it, and it aligns with their strategic mission. And they say, this is great. How can we get involved? And fortunately, there are policies in the public sector that support funding for these programs. And I think there are organizations on the other side that are interested, but maybe it's not at the forefront of their strategic focus, or maybe they're not eligible for the funds that are available to support these interventions. And we really need to showcase for them the impact on clinical measures and ROI that would make it a smart decision for them to launch a program.
Yeah, I remember, I think it was Geisinger Health might have had a program like this a couple of years ago. Maybe they still do. Tim, you see entrepreneurs of all stripes. Tell us about some of the learnings that you've seen that work well for people with a public health mission, and what kind of pitfalls you see some folks stepping into.
So first of all, I'd like to say that I think the notion that public health maybe isn't profitable or people don't want to invest in it, I think is old and outdated. We have a company, many people on this panel probably know, Iora Health, founded by Rishika Fernandopool, that was really looking at delivering healthcare in a totally different way, lower cost. They're written up in the New York Times for delivering primary care at $1 a day to people with low incomes. They were just sold for $2 billion. There, you can have big wins, you can have unicorns, you can have a huge impact, and you can make money. I think that probably the way we would encourage everyone to think about this is not so much to focus on, is it for profit or not for profit? Because at the end of the day, both of those are real businesses. They both have payroll. They both have to make investments. They want to sustain their organizations. They're really businesses either way. And instead focus on sort of who cares about the thing that you're trying to do and who's willing to pay to help you achieve it. George mentioned that some immunotherapies maybe the investors wouldn't want to pay for, but maybe USAID would. if they have enough of a mission in the right countries to bankroll that. So that could be an excellent business for Veer as a for-profit with the right partnerships. I'm sure you meant that. I'm just trying to say that, like, it doesn't mean that you can't take on something that has a public benefit. You just have to identify those partners with the capital and the willingness to focus on it. I would say for-profits have an advantage in that they bring a certain amount of rigor to the operations, focus on cost, expense, revenue, that kind of rigor. And they tend to be able to scale well. Nonprofits tend to have a little bit more of a challenge becoming kind of globally dominant in something. It's not that it's never happened, but it's rarer. And I would say nonprofits have that sense that there's a pure motive involved. So there's certain sources of capital that will only be interested if something's truly a nonprofit. They say, okay, I want to make sure nobody's trying to make a buck here. But that's less and less the case. And I think more and more your folks with the capital are saying, hey, I might like to have the benefits of a for-profit in the mix, that rigor, that ability to scale, that focus on practical things like profit and costs. And so we're seeing a trend in my world where most people are doing for-profits. They're going to regular investors and they're saying this makes sense. Mariana, I don't know that you had to go to special investors to get back. You just said, hey, we solve a public health problem and we also can make a lot of money and grow a lot. And so I would encourage you to pick your investors that do care about what you're doing, to your point, Dan. I mean, if they really don't care, then that might not just be that fun to work with them. And there are probably other investors, maybe Jenny's organization, that, if it's aligned with what you're doing, will care more and also have more relationships and contacts that could help you move forward given your strong mission focus. But I kind of reject this whole notion that there's a hard line, if you will, between mission and, today's entrepreneurial public health company.
Meg, maybe can I pick up on some of Tim's comments, because I think he's right on the money here. No pun intended, I guess. But let me point to Ebola as I think an example in my mind of how things can work extremely well. That we and other companies had generated antibodies that had the potential to reduce mortality in Ebola. Generating those antibodies actually doesn't cost very much money. The research is cheap on a relative basis. And we had isolated that antibody in collaboration with the NIH. So NIH then paid for and conducted a clinical trial of 4 different treatment regimens to test whether or not they could reduce mortality in Ebola. 2 of them did, 2 of them didn't. Ours did, and a cocktail of antibodies from Regeneron. Both had almost superimposable clinical data in the reduction of mortality. And then the question arose from the NIH of who is going to commercialize this and manufacture it and make it available. Our view was, we had generated this antibody. We were the logical company to do that. But of course, that's a diversion of resources and maybe isn't the best use of our people's time. But we felt a responsibility to make sure that that antibody was made available to patients who needed it. And so our view was, we will do it if no one else steps up. Right? And so just because we felt that responsibility, but Bridgeback and a separate company stepped up and took on the responsibility to manufacture and market that antibody, which they're doing now. So there's an example of how multiple organizations, both NIH and private sector companies, came together to make an important medicine available to patients who are suffering from Ebola, which are, there's no Ebola in the US, fortunately, yet. And so I think that's a good example of how things can work.
Jenny, can you give us an example of how you guys put together a portfolio there? Like, how do you think about just the market potential of things versus the importance of doing it for the benefit of humanity? I mean, as George was saying, we would do it if nobody else did it. I mean, those kinds of projects. Tell us about how you put it together, a portfolio.
Yeah, so first of all, I think because our investment strategy is focused on tackling global health challenges, I would like to think that almost everything that we do is for the benefit of humanity, and in particular those who wouldn't necessarily have been able to afford a very, very high price drug. But in terms of your question about portfolio construction, I think we think of it in a couple of different ways. There are certain infectious diseases that are only region specific. So it could be Ebola, it could be Zika, it could be dengue fever, whatever it is. And then those, if we can find a solution, whether it's a drug or a vaccine or a test that can ameliorate that situation, that in and of itself is one axis that we look at our investment strategy. And I think another one is an infectious disease or a condition that could apply to everyone in the world. And I'll use contraceptives as a very, very easy example. You know, women around the world, in the US, whether you're in a low or high resource setting, or whether or not you're in Nigeria, will want to have contraceptive choice. And oftentimes it's the same product. There's not much more research and development dollars that needs to go from a Nigerian product versus a US product. So when we think about portfolio construction, we think about modalities. So it could be drugs, vaccines, medical devices, diagnostics. We think about infectious diseases and indications that are region specific or truly global. And then the other way that we think about it is what stage of clinical development a certain portfolio company is. It could be a very, very early stage asset that doesn't necessarily have human data yet, or it could be a company that is just on the cusp of commercialization. So all of those factors mixed in together, we think of it as, you know, both de-risking, but also just making sure that we have all of our bases covered in terms of tackling challenges.
Makes a lot of sense. Mariana, tell us about scaling. You mentioned, you know, you're working with the CDC, obviously, and getting up a huge infrastructure here across the United States, but also looking into other countries as well. How has this entire scaling process worked for you? How have you approached it? What have been the challenges?
Yeah, it's been super interesting because we have been scaling our company like in the middle of this pandemic. So just for some context, 2 years ago, BioBot was only about 5 people, like including my co-founder and I. And today we are close to 100 people. So kind of growing that company through COVID and kind of that pandemic remote first approach has been definitely a challenge, a very interesting challenge. I would say another one that has been really fun to deal with is just kind of redefining what the public health of the future means. I think that, you know, BioBot really represents a new type of public health where it's a more interdisciplinary approach. We have data scientists and engineers and the lab folks and kind of, you know, all of this melting pot, right, kind of coming together to create a new platform for customers. And I think that that's been so important to be able to create a company that can bring all of those disciplines together to imagine what public health is going to be looking like. Because I think that we can all understand how the infrastructure needs to really be invested in and further developed to be ready for the next pandemic. And I would say a third one, which has been sort of like more interesting to come across, is that so far investment in public health has really been seen about strengthening kind of low and middle income countries that have less infrastructure than the US. But BioBot is taking an approach of US first and then expanding globally, because we also see the gaps here. So it's just been really interesting to come across, you know, like agencies and experts that really, when you mention you are a public health company, they imagine that we're working, you know, in Ebola, with Ebola, like in Africa, or, you know, kind of these type of applications. And it's like, no, we're actually dealing with COVID and the flu here. We're dealing with opioids and other substances that drive overdoses. So again, it's a little bit like recasting and reimagining public health and starting with an approach of actually like domestic first. And I think that that's been just like a very fresh approach to it all. And has fortunately brought us closer to the CDC in this endeavor. And I think that from there, beginning to understand how to then tap into other countries will be really important, because at the end of the day, all of those threats, or many of them, have the potential to affect everybody, as what Jenny was describing, right? And I think that's the type of applications that we want to go after, like the ones that can really spread through the entire world, and we want to keep an eye on that. So but yeah, it's been definitely fun to go from 5 to 100 in just like a couple of years, and kind of building on the fly, not just the product, but the company.
Yeah, absolutely. We're getting some great questions from the audience, and we already had some, so I'm going to try to start folding them in. But there is one that was just a specific follow-up for Dan from Jedri, who asks, what payment model works best for insurers who understand food as medicine?
That's, I think, a fairly involved question, because depending on the population and the specific challenge that you're looking to address, those funding streams are different. So are you doing food security? Are you doing diabetes prevention? We work with immunocompromised patients, and there are different public agencies that provide funding, different funding streams for each of those conditions. I think in a catch-all type of answer, I think value-based care and the capitated model around that, where here is the cost sharing, here is the risk sharing, and the opportunity for everybody to benefit when we're able to hit and exceed targets, when we're able to prevent costs from arising and share in those savings, and moving away from fee-for-service structure is really the way that we're going to see growth and foster greater innovation in the insurance market space.
Got it. Another one from Paul, which maybe I'll pose first to Tim, but if anybody else wants to weigh in, I'm imagining there might be some strong feelings about this one. He asks, what are your thoughts on the relationship between taxpayer-funded basic science and pharma, which can profit from that research and is not required to return profit back to the government for additional research? Tim, any thoughts you want to share?
Well, I mean, if you look at the history of global competition in innovation, the countries that have put heavy amounts of taxpayer dollars into basic research have also been the countries that lead the world in new companies and economic growth in the innovation space. So I think regardless of whether you think there's a moral imperative for taxpayer dollars to be used for research, I think you could make an economic, and I do, by the way, think there's a moral argument. If you're a wealthy country, you should be investing in making the world a better place. But if you don't believe that, I think you can justify this based on the incomes that you produce in your country, the healthy cities and healthy towns that result from new companies in every scientific space. Companies these days die in about age 50 or age 60. The average life of a large company is getting shorter and shorter every year. It used to be longer than that, significantly. And so we need to be replacing all our companies with next generation of generally technology-driven companies. And this is how we do that. I'm not sure if I'm getting at the questioner's basic point, but I would say there's a lot of self-interest there if you don't see it as a moral imperative.
George, do you have specific thoughts on this question? It comes up in biotech all the time. And there is even the constant sort of threat, quote unquote, of march-in rights, the idea that NIH funded something and so should be able to control how the drug is sold or how much it costs.
Yeah, I do have some thoughts, Meg. Look, there is a global research enterprise, not just funded by the US. Europe has major research efforts. Japan has major research efforts. Other countries around the world are all contributing public funds to globally advance the state of our knowledge in healthcare and in other areas as well. Companies do that as well. We, for example, at VIR had, I forget, many publications last year in first-tier journals, so contributing to the knowledge. That's a global enterprise. When there is something pragmatic that comes out of it, not just knowledge, but some tangible, either some potential drug or some test method or something, those are almost always patented. And then if companies want to exploit those, they have to in-license them and pay milestones, royalties, potentially some equity in the company to the institution. So there is a payback for research that's done that leads to something tangible. I am not at, I believe that the basic research that is funded by NIH and other governments around the world is done for the good of all of us, and for knowledge of how we work as biological organisms. So I think there's a fair return for things that are pragmatic, and I think the more basic stuff is kind of a societal responsibility for wealthy nations that can afford to do it.
Anybody else want to weigh in on that one?
I'll jump in and just briefly say that I think it's important to recognize too that these challenges that these organizations are solving are collateralized problems. It's not as though an organization is receiving a grant and then selling DVD players. You know, you're creating a solution to a challenge. Again, there's $330 billion in diabetes spending alone. And the majority of those cases are patients on Medicare and Medicaid. And those expenses, I mean, they're being paid for by the government, and those are coming out of our taxes. So it's having impact. It's addressing these costs that are being spread out over the population. And I think it's all connected, whether it's being directly funneled there or not. It does come full circle because these are, again, population health challenges.
Meg, I would add that, you know, that I don't know in this case, but in many cases when that question is asked, it's based on the misconception that NIH discoveries are it, you know, discoveries funded by NIH, and that a company just takes some prefab package and does the clinical trial and markets it and makes huge profits. That's almost never the case. That the basic research findings that are funded by NIH can point the way, but there's a huge amount of risk, a huge amount of basic research that has to be done. Products have to be actually manufactured, clinical trials have to be done. All of that has tremendous risk. And so those are all efforts that are largely borne by the private sector.
If I can add also something quickly to that comment, I would say that in general, there's an opportunity to largely rethink what the role of the private sector is in fostering population health, which I think traditionally has been seen as more of a role that a government needs to play on its own. And it has led definitely to some level of siloing from, you know, kind of what happens within government agencies and how they tackle public health challenges versus all of the innovation happening, not just within universities that are funded through grants, but also within companies. And I think that ideally what happens, and one of the takeaways and learnings from COVID, is that it actually needs to be, it's not just about government. You also need companies that are being built in this space, that are being funded, and that are fully dedicated to solving pieces of this larger puzzle that is population health. And, you know, BioBot now, it's like an example of that, just as the other panelists here, where government is one of our core customers because they are acting based on the data, they are taking action based on the data, but now they are not the only ones. Now we have interest from enterprise, other companies that also need the data to do their job, whether development of pharmaceutical products or others. And I think like that's something that ideally we can further promote. Just this idea that population health doesn't have to be just the mandate of government.
That's a really interesting point. I did actually want to pivot to the discussion about having the government as a key payer for products. And we've seen this through COVID. Through so many of these products are only approved through emergency use authorization in the US. The government right now is the buyer. Jenny, from an investor's perspective, not just about COVID, but generally if governments would sort of be the main customers, how do you look at that as an investment?
Well, frankly, I would love that, and that would actually give me definitely a second look. But the devil's also in the details, right? So I think when you're especially working in the biotech industry, and there's a lot of risk involved, as George was just saying, and you have to put in a lot of dollars and time spent to develop something with the potential of having it in return. Having a government or a very large multilateral organization like the World Health Organization, as another example, to be the buyer or the customer, or to help you shape the market or build the market if a drug or vaccine is approved, it's hugely beneficial from a risk reward perspective. And it's not just even from a, me wanting to generate only financial returns, but there's a lot to do after something is approved to get into the arms and hands of and mouths of patients around the world. And it's oftentimes these government agencies or multilateral agencies who can help with the delivery of that. And you're not going to truly understand what these customers would want unless they also become a buyer and work with you to shape what the entire commercial strategy from start to end can be. So it's hugely important.
And I guess I'd open it up to everybody else too, just in the experience of selling to governments. I mean, one of the problems we're seeing, at least on the big federal level here in the United States right now, is Congress doesn't want to keep funding buying more vaccines and drugs and funding testing and things like that for COVID. So in general, in your experience, and I know, Dan, you're not working in COVID specifically, but from your experience, potentially as having government as a customer, has it been good or bad? What have been the good things about it or the challenges? And this is who wants to jump in.
I think that just in general, there are some challenges in working with government in that it's a large organization. There tends to be a lot more red tape that you have to operate around. And I think that all of those, regulatory pieces or whatever they may be are there for a reason. Sometimes that's a little bit more challenging as a small startup that needs to respond quickly and interact very nimbly. But it does represent a great opportunity. And I think that the government as a whole has a really significant opportunity, kind of like what Jenny was saying, in creating a market, in being an early adopter. I think compared to other organizations in the private sector that are going to perhaps bear significant risk or have less risk tolerance, working with the government for a funding stream and as a customer allows you to really prove out the impact, to generate the cost effectiveness, the ROI data that you can then go to these larger corporate clients and use as a proving ground and validation and the impact and de-risk it for them. And they're, I think, really helpful in crossing that chasm and getting to that place and allowing you to kind of take those bets and run those pilots.
Yeah, Meg, if I could just jump in there, sorry. I think the other thing is we oftentimes, hear lots about what the government is not doing. They're not, continuing with the program and all that. But there's also a lot of things that the government is doing that we don't hear about. And I think one, we may not just hear about it in the media, but also the other thing to recognize is while there are a lot of government funded programs that can be helpful for biotech, sometimes the timeframes is a little bit longer, right? So to Dan's earlier point, like you may need funding now as a small biotech company. You can't wait for the government contract that's going to happen in 5 years. But I do want to acknowledge that there's a lot of things that's going on right now in service of public health that we just may not hear about.
It's a great point. Oh, sorry, George, I'll go over to you in just a sec. I was just going to note that, we're hearing about monkeypox right now. And I recently spoke with the CEO of Bavarian Nordic, and he was like, the US funded the development and the manufacturing of this next generation monkeypox, smallpox vaccine. And the US has more doses than any other country in the world. I mean, whether the US actually needs those doses, I think is a big question. And should we make them more available to other countries? But it was just sort of a reminder in this time of not seeing COVID response get funded, that we do fund a lot of other stuff. So that's a very important point. George, and then Tim, and well, we've got a lot of weighing, but George, go ahead.
Okay, sure, Meg. Look, there are a lot of chain differences now when the government is buying a product, the U.S. government. And, normally drug prices are higher in the US than they are in the rest of the world. I think that's generally recognized and generally true. That's not the case with COVID drugs, because the US government is the largest purchaser and they have negotiating leverage. And so the prices are relatively constant throughout the developed world. So that's one difference. The fact that they are authorized but not approved means that companies can't promote them, right? You can't go advertise them for sure, but you can't, it's very difficult even to educate physicians on the appropriate use of the drug. And so, for example, the antibodies for the first year of the pandemic were just not used because people didn't know how they worked, and the information, companies couldn't get that information out. People died as a result of that lack of information. And it actually took, I think, Governor DeSantis in Florida to just, to poke a finger at his political opponent, not to promote vaccines, but to promote antibodies and set up antibody clinics. That raised awareness around the country, and that allowed a lot of physicians to actually learn for the first time what they could do. So I think the government actually has done a good job. I'm not critical at all of the government. I think the government programs to speed the development of vaccines and therapeutics worked amazingly well. And we have amazing vaccines and drugs available in unbelievably short period of time. And that was a joint effort between the industry and the government. That worked incredibly well. There are things that could be better in retrospect, but that's always true. I think in general, that's working extremely well. And I think the issue now is actually making sure people understand the appropriate use of the drugs that are available.
Yeah, I've heard that's an issue for Paxlovid too. And Tim, I'll come to you in just one sec. George, is Florida a main market for your flu?
Oh, sorry. No. No, I mean, we sell to the federal government, so they distribute it however they think is most appropriate. So we have no.
I was saying for your upcoming flu antibody, will Florida be a key market for you because they've got the antibody administration infrastructure?
We have clinical trials set up globally because we don't know where the pandemic is going to be most intense, and so we have centers all around the U.S. and so that we can capture if there's, for example, in the Northeast, if there's worse flu than there is in the South, we'll be able to, or vice versa, we'll be able to capture that. So without knowing, Florida was a major site of our COVID trial because the regions of the country with low vaccination rates were more eager, actually.
Mm-hmm. Tim, jump in.
Just a couple of quick points. First of all, I want to agree, government has been a very effective supporter of the COVID response these last couple of years. I think as an example, funded things very quickly, very broad. It took us about 4 weeks to go from being asked to submit to getting awarded a statewide contract to test all schools. So these are not, these are much faster than what I see in industry. So I think the notion that it's always slow, I think is not correct. It may be that crisis response is a place where public health entrepreneurs can get more traction. So if you have ideas about responding to something which right now matters a lot to a given government, that might be a good moment to, explore moving quickly. I do want to address some differences I see between governments in how they manage and implement healthcare innovation, just briefly, because it does affect entrepreneurs in this space. In the US, we had rules in place throughout all of COVID where a physician needed to prescribe a test for COVID. It was just at the very end as antigen tests that were over the counter started being issued that you didn't need a physician prescription. And we would pay about $5 a test that was paid for by governmental entities for a physician that had never seen the patient to sort of click a button on a computer. This would be an example of where government could, I think, be more nimble in its thinking about how it regulates and sort of opens itself up to innovations, where in other fields, like, Uber or Airbnb or something, people sort of move fast and break things and kind of invent. In healthcare, we tend to move slowly for lots of good reasons, but what it can mean is that we don't get as much innovation or we pay more than we need to. But a counterexample of that was where many states said, look, we're going to allow, we're going to relax who has to be the person to give the test. We no longer need, say, a nurse. They said essentially anyone trained could do a swab for a COVID test. And that opened up and reduced cost and made it much more accessible to get tests. In other countries, they didn't do that. In Mexico, for instance, you still required medical licensed professionals to swab. And as a result, testing was very unavailable in Mexico for a long time until antigen tests, over-the-counter tests became more available. So just a thing about government is it can move quickly. And I guess this is a little bit of a call for those in the policymaking worlds to think about how can we bring some of the speed of innovation that we see in tech fields into the healthcare innovation space. A little bit off topic for this panel, but I want to just put a plug for that.
That's important. Mariana, do you have thoughts on this?
Yes, so many thoughts, but I will keep it brief. Just to mention that, yes, as an early stage startup, and that needs to be raising money like every other year or so in order to continue growing the company. Definitely selling to government as the core customer was something a little bit like unique. We didn't come across many investors that were as comfortable with it or experienced with it as Jenny herself here. So it took a lot of education about actually the advantages of even selling into government and how that looks like. And indeed, in the very beginning, we knew and we went through that, right? It was tough to break into government as a customer, especially my co-founder and I were outsiders, right? We hadn't been working in government, so we didn't have sort of that kind of Rolodex to start from. So that breaking into was tough. But then once we're there, it's been amazing. I mean, it's been a market with so much organic development because people know each other, they talk to each other. And as generally speaking, like government agencies are not competing with each other, right? To make profit or to gain market share of any sort. So they all share, they all talk to each other. And our government vertical is just being so organic in its growth. Where
how did you break into the government without coming in as outsiders? What was the foot in the door?
I think there were I would say there were two things that really made a massive difference. One was a little bit like bottoms up, going to knock on doors and try to meet just as many people in person as possible to share our vision. And second, a little bit of a growth hack, because that was, going slow, as you can imagine, was to actually self-fund a pro bono campaign to get our service and our data in the hands of as many communities as possible. We did that in early 2020, and it went viral. Like, it got picked up by the media. We ended up being covered by venues, like Washington Post or the New York Times, all the way to the Daily Show with Trevor Noah. And we managed to work with about 400 communities during that pro bono phase. And that just allowed them to get a taste of the data and to just get the conversation started. And those two pieces just is what allowed us to get our foot in the door.
Oh, Dan, there's another question from the audience for you, from John, who wants to know, what is the benefit to a CEO of founding a public benefit company?
We thought about this question a lot in the early stages. Should we be a straight for-profit? Should we be a nonprofit? Should we be a public benefit corporation or some kind of hybrid model? And we looked at a number of similar organizations. There are a lot of, I think, great examples of food as medicine organizations in Massachusetts and more elsewhere as well, to see how did they do it? What were the challenges? What were the opportunities? And we knew that we really needed to go in the for-profit direction for two reasons. Was one, we did not have a large network of donors. We did not have a background, the founding team and myself, in grant writing. And if we're going to get started, we've got to be able to sell equity. But also, and as somebody mentioned earlier, it might have been Tim, I think that nonprofit organizations are often limited in their ability to scale. And today, Eat Well is looking to serve all of Massachusetts. Tomorrow, we're going to be looking to serve all of the US. and need to be able to grow and have the ability to raise funds to support that growth, especially without that donor network or particularly adept grant writing skills. As far as being a public benefit corporation, what that really amounts to is us having a stated purpose in our articles of incorporation that allows us to pursue a specific purpose, in this case, to increase the accessibility of nutritious food beyond simply returning value to the shareholders. And so in many ways, it gives us the confidence and the comfortability in knowing that we have an organization that can prioritize impact without giving up profits. And to many other organizations who often, I think, are a little gun shy at working with groups that are not exclusively nonprofits, to say, this is who we are, this is what we believe, and this is not just words on a slide, but rather in the foundation of our organization. And Public Benefit Corporation seems like a really great vehicle to do that.
We're getting close to the end of our time together. I do want to get to one audience question, and then we'll do a quick lightning round to wrap up. But from the audience before, and Mariana, maybe I'll come back to you with this, or Jenny, and I don't mean to only come to the women with it, because the men could have good, thoughts on it as well. But the question is, how can we encourage more women entrepreneurs? Mariana, do you want to start on that? You mentioned coming as 2 women co-founders. That was a real challenge.
Yeah, and I would only say, to those women in the audience, that if they have any interests or inkling about becoming a founder, to just go out and do it. Because I've met many women who want to become founders and want to become CEOs. And what they do is they just they think they are not ready, and they go and work at other companies or other startups to learn before doing it. And actually there's no job that is going to prepare you to be a founder and to be a CEO. So I always say the same, which is like, oh, perfect, you want to do it? Just go and do it. Do it tomorrow. Just go and try. And I think just knowing that it's okay to try and learn on the job, I think that it's a very important message to get out there.
Yeah, I would totally agree. And by the way, I give myself this advice all the time too, is just go do it. So I like to practice what I preach. But I think the other thing to encourage more female founders and CEOs is just to network. And so for everyone out there who wants to found a company or to start their own thing, seek out mentors, and not just female mentors, seek out male mentors as well. Because I think that diversity of support, network, opinions, pushback, constructive feedback, all of those things is just really important. So go for it.
Great advice. Anybody else want to weigh in? Anything you've seen as successful?
Well, at the risk of wading into something that can get me in real trouble here, let me say that I agree with Mariana and Jenny. I think often it's an issue of confidence, that if you don't know 20% of what you need to know to be successful, you can either say, okay, I know 80, I'm going to figure out the 20, or you can say, well, I don't understand those things, I probably shouldn't do it. And I think more men are in the former category and more women are in the latter category. So I think encouraging people just to do it, giving them confidence and training in how to do this. And so specific programs on how to be a leader, how to be an entrepreneur, on understanding the industry, and programs targeted on people who are underrepresented in the entrepreneurial community, women and minorities, I think are incredibly important, and something that we all should be very active in doing.
Something that I would add.
Go ahead, Dan. Yeah.
The way that Eat Well thinks about things is I guess, a systems approach. And so if we want to decrease the incidence rate of, say, diabetes, we are looking what is at the top of this funnel, what is driving this, how can we ensure that folks have sufficient access to affordable, nutritious food? Thinking in a parallel way, and of course, I don't have personal experience with this. It seems like a lot of startups today are coming out of STEM fields in science, technology, engineering, math. And as I understand it, there are far fewer women in those fields, girls in those fields in school, or passionate about those materials. And I think what we can really do is, at the top of the funnel, ensure that there is STEM materials, whether it's in majors or materials prior to that, that is opening and inviting and encouraging, ensuring that this type of material is presented in a way that is accessible to everybody, regardless of their gender, and really ensure at the top of the funnel, we're seeing really significant diversity in folks entering STEM fields that often lead to entrepreneurs.
All right, I'm going to bring you to our final lightning round, unless Tim has any, urgent message he wants to add to that question. Okay, I'm going to start with Tim then, but this question is for everybody. Do you think the interest in public health startups will dry up as the pandemic fades away? Please let the pandemic fade away first of all, but as our attention to the pandemic fades away.
Yeah, I mean, I don't think we're seeing evidence of it. I think a lot of people have come into the field. We have seen waves of innovation in other industries sort of legitimize innovation in that space. I'll give you an example of education startups. There was a period of time when investors said, just don't invest in education startups, it will not go anywhere. And then it became in vogue, and it still is. There's an enormous amount of investment in that area. I feel as though it's more about getting the capacity in the investor community that understands these topics, cares about these topics, and wants to invest. And I think we have that now. And I think that we're unlikely to see innovation fade away in this space. I also think around the world, we're seeing a greater interest of those bright people coming out of school saying, hey, I want to become an entrepreneur, instead of, hey, I want to go work for a large company. And so that is providing us a steady stream of talent interested in focusing on this area. I don't see any evidence that that's slowing.
I'll go next to George. Your thoughts on this? I also just want to add a slight addendum to the question to you, which is I'm curious about. I just wonder, with the focus that you have, sometimes Wall Street, won't be interested in a project, but I wonder how much benefit do you get from, either ESG funds interested in the kinds of things that you do? Does that benefit your company? And also just the fulfillment that employees might get from the idea that you work on this sort of breadth of projects.
Yeah, so let's take that last one first. Excuse me. We are a mission-driven organization. A large fraction of our workforce chooses to work at VEER because we are tackling the diseases that we're tackling, and they are committed to doing that. And so you have a workforce that's incredibly dedicated to achieving their goals. So that absolutely would benefit from. I think in terms of the funds, yeah, it probably helps a little bit. It's not a major investment. I think what Jenny said is right, that investors are fiduciaries. They have money from their limited partners, and their job is to maximize their returns. And so they have to make decisions on that basis. So the ESG issues, I think, help around the margins, but aren't a major driver. My issue is, think about pandemic preparedness. So, COVID's the third coronavirus epidemic: SARS, MERS, COVID. Unlikely to be the last, right? There are so many different coronavirus circulating. There are other organisms that are capable of causing pandemics. Flu, them, Zika, whatever, dengue, and others. Hopefully not monkeypox, but we'll see. And what we should have learned is that we can and should be better prepared, that there aren't 100 different organisms that are likely to be the cause of the next pandemic. There may be 5 viral families that if you had reagents ready for, you could avoid what we're seeing now and what we've seen the past couple of years with COVID. So, there was some energy around that during SARS and MERS, and it faded. There is energy around that now that I see, and hopefully that will keep up. And I think I'm optimistic that it will, because COVID's not going away. It's not, unfortunately, it's not going away, and I think it's here to stay and become an endemic. And so it's going to be something that is going to be a constant reminder of how we need to be better prepared than we were in the past. And being able to make RNA vaccines in 3 months and getting distributed in a year isn't good enough, right? I mean, it's great that we can do that, for sure. I don't want to, diminish that contribution, but it's not by itself the solution. And so I hope that there's continued determination on the part of governments and companies to work towards prevention of future pandemics.
Well, Jenny, I'll bring the lightning round to you next. Do you think the interest in public health startups will dry up as the pandemic fades away?
I don't think it will completely dry up, but I don't think we can sustain this level of attention either. And I often think that, real progress and real change, you kind of swing the pendulum one way to the other and then back, and then over time you kind of adjust, and that's when change actually happens. And I'll give an example. At the beginning of the pandemic, when I got probably 10 COVID test pitches in my inbox every day, I no longer have that now. And there was this notion that, because everybody's going to start testing for COVID and all the other infectious disease because of people's personal responsibilities. I never quite bought that argument, but I do buy the argument that now, as a general population, we're much more aware of testing's abilities, maybe even the differences between a PCR test and an antigen test, whereas people had no idea what those words meant. So there is some incremental progress, but I don't think the level of attention or mind share is necessarily sustainable, nor probably is it healthy, because we're going to have to shift our focus elsewhere.
That is a good point, though. As a mom of a 3-year-old, I would like a home test for every respiratory infection. That would be very helpful. Dan, I'll go to you, and then Mariana for the last word. Dan, the lightning round question is, do you think the interest in public health startups will dry up as the pandemic fades away?
I don't think so, no. I think that when you look at the leading causes of death in the US, number 1 is heart disease, number 2 is cancer. Again, Eat Well is coming from a non-communicable disease standpoint as opposed to infectious diseases, but those conditions are not going anywhere. Those don't care about pandemics, whether there are other pandemics coming or not. Diabetes is not going to get put on pause, get put on hold. Those are huge problems, and with huge problems is tremendous opportunity, so incredible spending, and therefore significant opportunity to prevent that spend and create value. So I think the opportunity is incredibly significant.
Mariana?
Yes, and I think that I largely agree with what Jenny kind of mentioned, and I think that during COVID, there was no problem just spending money addressing the pandemic, and I think that just everybody across the board was freely spending and addressing the immediate crisis, whether government, whether companies, whether even on a personal level, kind of overspending to deal with the crisis. And I think that what's going to happen is some of the innovations that were developed during the pandemic will survive that kind of post-pandemic transition and will become embedded into the fabric of our society. But a large part of them will also kind of be dropped altogether because they won't make sense sustainably in the long term. And I think the fun part will be to kind of figure that out, kind of from not just from the investment side of things on the investor side, but also within government, kind of where do they keep the money flowing and where do they just kind of close it down. But I think what's real is that I don't think that the investment will go back to zero. I don't think that's going to happen. So I think on the overall, it's probably going to be more positive and supportive for public health startups on the overall.
Well, it's a fantastic conversation. I want to thank all of our panelists, Tim, George, Jenny, Dan, and Mariana, for a fantastic conversation. Thank you to the audience for your really great questions. I wish we could have gotten to all of them. And of course, I want to thank Harvard Public Health Magazine for hosting this discussion. And if you missed any part of the program, you'll be able to view it on demand at the Harvard Chan School's YouTube channel. So thanks, everybody, and have a great day.